How adequately are the most vulnerable members of society being shielded from the direct impact from political strife, from economic pressure, or even the unexpected but very dire situations like the coronavirus pandemic? How much has Africa really cared about pregnant women, nursing mothers, and those who take care of them? We will now delve into a discussion on this with someone who should know. And our esteemed guest is Mrs. Toyin Saraki, a former First Lady of Kwara State and President of Wellbeing Africa Foundation. Welcome to the program. Good morning.
Good morning, ma'am. Welcome to the program.
Good morning, Ms. Leila. Good morning, Dr. Rubin. Thank you for inviting me.
Yes, thank you for joining us too. But before we begin to talk about issues of maternal and infant health care and the plight of nurses and pregnant women, let's start with something that happened recently, because funding is part of some of the processes you are involved in. The United States decided to suspend funding to the World Health Organization on the grounds that the WHO has been helping China to cover up information and to mislead the rest of the world. What's your take on this? Do you think that the United States should, at this time, play politics with the World Health Organization? And how do you think this will affect the capacity of the WHO to be able to deliver on its vision and mission and involvement in COVID-19 management?
Well, the one thing that the COVID pandemic across the world has shown us is that we're all connected. We're all hurting. The entire world is hurting from COVID. I believe that the WHO has been a very, very active standard bearer, a repository of knowledge, and a driver of research. There is no doubt that every nation state is working together and also working apart to try to combat and control the COVID. I think this situation around the world is actually showing us that we all need to rally more around the WHO. We need to increase funding for the WHO so that, as well as immunizing, the research work they do, they can actually be more functional and faster as the guardian of health. There's no doubt the United States is actually a very pivotal partner to the WHO and to individual countries, to anybody that cares about health, about water, sanitation, and hygiene. So we mourn those who've been lost. We are grateful for those who have recovered, but it's very, very important actually to increase the capacity and the funding to the WHO, and I think all member states should do this so that they can actually help the world contain, trace, track, measure, and drive that research in the hope that we're going to find a vaccine very soon.
Certainly, Mrs. Saraki, I couldn't agree with you more. And in the course of this conversation, we'll speak about a lot of the work that the Wellbeing Foundation Africa is currently doing to support the fight or to work against or help in the fight against COVID-19. Now, this pandemic has exposed just how fragile global healthcare systems are. But even more so, ma'am, this pandemic has exposed really and truly how healthcare systems marginalize, but not just marginalize, but also traumatize Black women. Now, statistics show that Black women are 2 to 3 times more likely to die during childbirth than a white woman. Now, let's take this situation to rural parts of Nigeria right now, where already it's hard for women to get access to hospitals close to them, and there's an outbreak of a pandemic. How can we help more? What health interventions do we need to see to support women, not just during childbirth, but also during pregnancy and also the postnatal period at a time like this?
Well, the first thing that really a pregnant or recently pregnant woman would need is the assurance that the essential maternity services are not actually going to be affected by lockdowns. I was actually quite pleased, I think it was about 10 days ago, when the National Primary Healthcare Development Agency made an announcement that primary healthcare services will continue as normal during the lockdown. This has a direct bearing on pregnant women, on recently pregnant women, on their newborns, and also on immunization. I think that the very important thing is to make sure that there is free and accessible information to every single citizen every day not just during a pandemic. And this is actually what led me in 2004 to actually start the Wellbeing Foundation Africa. Because I don't know if you're aware, I had an experience of my own, but I felt that what saved me was information, knowing where to get the medical help, having some idea, some expectation of the type of help that I should receive. Now, when we talk about pregnant women and newborns, really what we're talking about is primary health care. I have said it many a time in trying to persuade nations to invest in primary health. You know, primary health is the most basic form of health, but it's actually where preventive medicine should take place. It's where proactive medicine should take place. And it's where you should actually make the patient or the citizen an equal partner in their own outcome. I've always said, if I was to slump in the street, I wouldn't be able to choose whether I'm going to go to some private hospital that I particularly like. I'd be taken to the nearest hospital. And this is the biggest argument for improving the availability and quality of primary health to every single citizen. When we look at COVID, COVID really is the biggest test of the social health contract between a government and its people, because the very first check that you take for COVID is a check that you take by yourself. You're checking your symptoms, and then you're accessing, hopefully, your government's system to say, look, this is what I'm feeling, and do I need to come into a hospital? Now, where there's no trust, that contract breaks down immediately. And this is actually where the Wellbeing Foundation's free COVID health check comes in. I want to put the power back in the hands of the citizen. You are supposed to be the first guardian of your health. And if you're an informed guardian of your health, you can then actually demand the right quality of services for yourself, for your child, for your family. And I believe that even our youth, you know, the one thing that is certain is that the young of today do not ask each other for information. When they need information, they ask the internet. And so it's so important to have the right information and the right systems out there on the internet as a bridge or a pathway to help everybody connect to. In Nigeria today, the leader of the COVID fight is actually the NCDC. The NCDC has, I don't know, about 20, 30 telephone numbers, but they are under strain. So I need to make sure that each citizen checks themselves from an accurate triage tool, and then that will assess the risk of, are you likely to have COVID at the moment, or are you not likely to have COVID, and immediately connect you to your government system for where you're going to be able to get help. I heard the conversation earlier, I was listening to whether private hospitals should be treating COVID. You know, COVID is a public health emergency. Now, if we don't have enough beds in the public health system, then what I would expect is that the government would co-opt, you know, on a formal basis, the private health system and make sure everybody's operating to the same standard to make sure that we can actually track and trace where these cases occur. I was very sad to hear yesterday of a doctor that had died because he was treating a COVID patient. But this is a point where every single medical provider in the country should rally together to be called upon by the government and to work to the government standards. We're hoping that we're not going to see community spread in Nigeria, and the WHO is tracking this very carefully, but we may all have to play our part.
Well, the point you made about primary health care in particular is very important, but I would like to know what your assessment is of what the Nigerian government has been doing so far and what else you think that the Nigerian government can do. And then in particular, what has the Wellbeing Africa Foundation been doing in the context of COVID-19, particularly with regard to your washing of hands campaign and then what you refer to as a 30 seconds COVID check?
Well, the Wellbeing Foundation Africa works with mothers and midwives across the country to ensure adequate maternal and newborn health. And we have a range of programs and advocacy campaigns, which we address very squarely and weekly. We also include the standards of water, sanitation, and hygiene, which is of critical importance with a focus on infection prevention and control. When we actually started our WASH program, Wash for Wellbeing in 2018, we all know that we had to have clean hands, but I saw a set of statistics in Nigeria that actually showed that only about 22% of hospitals, health facilities actually had access to clean water. Meanwhile, I think it was in the 1600s that a researcher named Edelweiss discovered that all the patients being treated in his hospital by the doctors, the ones being treated by the midwives were not. Now, this is because the midwives were not working with cadavers, but the doctors were. And this is really where hand hygiene started. So for over 2 years, we were actually trying to stop newborn and maternal sepsis when we started our WASH campaign. And then COVID comes along, and the first response to COVID is hand hygiene. I'm glad, I think the entire world knows now that you have to wash your hands and you have to keep your hands clean, which extends to surface hygiene, it extends to respiratory hygiene, and it does also extend to environmental hygiene. You know, we know now that COVID can live for at least 3 days or more on a surface, and it can actually live for a month in your fridge. So we have to all be very, very careful, and we have to make sure that we are keeping clean. Now, for the COVID health check, I noticed there was a lot of disinformation out there. There were a lot of myths that were rising. And then also there was stigmatization. You know, people are almost scared to, cough or sneeze in public because they think they're going to be hauled off to an isolation center. So our main aim was to provide a free COVID health check for Nigeria's 200 million citizens. We want to educate the public on how to stay healthy, provide information, and inform whether people should get tested or self-monitored. We also want to give public officials critical insights into vulnerable populations and COVID-19 hotspots. We want the check to be as accessible as possible. We want people to be able to access it both online and offline. And the check is very quick. It takes about 90 seconds and it's totally free. It determines if a person needs to visit a coronavirus test center or isolate based on a series of questions. It also allows them to put in their location if they opt in to put their location, but they must put their recent travel history, and every symptom must be entered in to ascertain whether a person needs to get tested or not. If the site determines that a person needs to get tested for the virus, it will share emergency numbers for the NCDC location closest to where they live. And using that, we gather anonymized insights into the regions of Nigeria that are considered vulnerable for the coronavirus spread, and we share that with the authorities so that they can target their efforts promptly. People can take the check at covid19.wbfafrica.org, and please follow us on social media at Wellbeing Africa and at Wellbeing_PPMD. We have worked very closely with the NCDC, the CACOVID, federal and state governments, and I think everybody sees this as a tool to complement their existing efforts. We're actually now mushrooming into a COVID alliance because we've received backing from new partners, including My Pharmacy, which is the largest network of pharmacies in Nigeria, and from doctors, midwives, and nurses across the country. Very crucially, the more people that take this check, the more effective it will be in helping us to assess the risks in Nigeria and where the hotspots are. As of, I think, Thursday, Nigeria has had more than 400 confirmed cases of COVID. We've also had a significant number of recoveries, but we're looking at the time that it takes between when a person is first tested and when they are actually released for recovery. It's very, very important that everybody comes together to continue to track, to trace, to detect, and also to self-report. I see COVID as an emergency, but I also see COVID as a chance for governments to establish a new health and well-being social contract.
On that note, Madam, we'll take a short break. When we return, the conversation will continue. It's just a commercial break. Stay with us.
Welcome back to the morning show here on Arise News. We're still joined by Mrs. Toyin Saraki, former First Lady of Kwara State and President of the Wellbeing Africa Foundation, or rather Wellbeing Foundation Africa. Welcome back to the program, ma'am. Thank you for staying with us. Before we went on a break, you were speaking about data and particularly the Health Quick Check tool, which of course people can find online on your organization's website and also on social media. And it's a great recommendation. Now, I'd like us to also speak about recommendations when it comes to filling institutional voids in maternal health care post-COVID. We're seeing so many gaps here, and this pandemic has shed a light on a lot of situations that maternal health care is strained by that we actually need to address going on. So what recommendations would you give in terms of filling institutional voids post-COVID within Nigeria and also globally, to be honest?
Well, the one thing that we have certainly learned from COVID is that primary health is the front line where the battle will be won. I don't want to say lost because I think we now all recognize that imperative. We talk about health for all. We talk about universal health coverage. But the truth of the matter is people need affordable, quality health within easy reach of their homes. There is a role for telemedicine, but there is no replacement for bricks and mortar health centers that are properly equipped to deliver high quality care in an affordable manner, which does not discriminate between who is seeking that care. Now, you cannot deliver quality care without addressing the biggest issue, which is actually the conditions for the healthcare workers. How many healthcare workers do we have? What is the ratio? What is the ideal ratio of healthcare worker to citizen? Really, the WHO has stated that you need one qualified healthcare worker, whether that be midwife, doctor, nurse, lab technician, to every 400 people. Nigeria's ratio at the moment is between 1 in 20,000 and 1 in 40,000. So we do not have enough qualified healthcare workers, and they are not employed at the right standards and remuneration that will help us to retain them in the system. I'm hoping that coming out of COVID, we are going to really address delivering primary health under a new paradigm to our citizens. If the government cannot do it alone, we will have to consider PPP models where private sector can help the government out. And we have seen CACOVID in this instance come to the rescue of the federal government quite efficiently. So we need more of these imaginative models where the private sector can actually be outsourced to provide public health services and be paid for doing so. The truth of life is that nothing is free. When they say something is free, somebody is paying for it. I have made the Wellbeing Foundation Africa's Pocket Patient MD free, but it's a very significant contribution. It's just that it's a contribution that was imperative at this time and had to be made. Everybody should have access to the right standard of information, and everybody actually should have the right expectation for their government. If one good thing has come from COVID, it is that every single Nigerian, COVID is a democratizer and an equalizer. We are all in the same position in the lockdown. If anybody thought before that they could afford to ignore the public health system because they thought they had an opt-out clause, COVID has shown us that our public health system has to be good enough for all of us to access. And this is an investment that, well, I'm already working on some solutions, and I hope that everybody who considers themselves a stakeholder for the health of Nigeria and for the health of Africans, because the connectedness of COVID has shown us that, the health of a Nigerian in Bagada will have a bearing of the health of a German in Dusseldorf. We have to begin to look at global health truly as global health. The health of the person in the village is as much global health as the health of a person in New York.
Well, pregnant women face challenges. Probably the fear of transmitting COVID-19 to their babies, particularly if the pregnant woman is positive, COVID-19 positive. And nursing mothers, of course, who are positive, they also face the challenge of the risk of breastfeeding and infecting the baby. And of course, we know midwives are out there on the front lines. But there is a bigger problem, in my view, the problem in households. Households are under very serious pressure. And we've seen a spike in cases of domestic violence. And here in Nigeria, there have been all kinds of videos that have been circulating, showing pressure between husband and wives and vice versa. What would you say to women who are facing this challenge of domestic violence, and to the men who seem to be the main perpetrators, as we have seen in many of the cases in Nigeria?
You know, COVID lockdowns have meant that people are restricted to their homes, and all the other distractions that might have allowed them to avoid dealing with certain issues are concentrated. About 2 weeks ago, I was actually following the data, and immediately I started an awareness campaign, and it's called the Stop, Think Twice campaign, because I want people who are wanting to lash out just to stop and think twice whether that violent action that they're about to take is going to have any effect whatsoever, a beneficial effect. You know, we have an old African proverb that says you cannot approach a raging river in a rage. You're not going to be able to navigate a raging river if you yourself are in a rage. But, you know, we have to look at the socioeconomic circumstances around this. You talk about pregnant women. First of all, the WHO has actually said that pregnant women are at no higher risk of COVID than somebody who is not pregnant. That said, we will track pregnant women and recently pregnant women, because we're talking about 2 lives here. A woman who is positive for COVID can still breastfeed so long as she actually observes respiratory hygiene, hand hygiene, and wears her mask. You know, when you're talking of a woman and a newborn baby, you actually cannot separate the health of the mother from the health of the child. So if it is a normal delivery in every respect, apart from the COVID element, you can still look after the mother and the child together. To go back to the socioeconomic economic aspects of it, the informal sector in Nigeria has been hit severely by the lockdowns. More than 80% of Nigerians work in the informal sector. It includes a wide range of occupations: street traders, taxi drivers, tradesmen, artisans, food vendors, hairdressers. In Lagos alone, 65% of the estimated 25 million people work in that informal sector. And they are being hard hit because they are actually having a day-to-day income that they don't have access to. I believe that the Humanitarian Affairs Ministry started paying 20,000 naira, which is $52 to families registered in the National Social Register for poor and vulnerable households. But there's no doubt that there's a strain on families and a strain on households. I would like to call on families and households, not just in Nigeria, but around the world, to see COVID as a chance for all of us to reconnect with each other on a closer basis, and to understand ourselves better, and to give ourselves more respect and leeway. I'm actually very hopeful that we will come out of COVID as better humans, better humanitarians, better humanists, and better citizens. But definitely violence has never been the way to deal with worries. It will never be the way to deal with worries. I would like to ask everybody to just stop and think twice. You know, we say be safe, be smart, be kind. You know, COVID has shown us that there is no escape from the basic social values of life. And it's a fresh chance, actually, for everyone to get it right.
Well, certainly I would agree with you there, but unfortunately it just doesn't seem like that's the reality. We heard of the case in Italy where a doctor was killed by her husband because he suspected that she had given him coronavirus. Her dead corpse and him both turned out negative. We're hearing of huge spikes and increases in gender-based violence going on across the country here in Nigeria. Now, the Lagos State DSVRT, the Domestic and Sexual Violence Response Team, have put out 11 numbers that people people can call if they do find themselves in those situations. However, ma'am, briefly, let's also think about the fact that realistically it's hard to pick up the phone and make a call in front of your abuser. Do you think that we need to start looking at adopting more creative measures for survivors, really, and also vulnerable people to gender-based violence at a time like this? If so, what as well?
Certainly, and there definitely, as you say, you're not likely to make a call for help in front of your abuser. The other thing we have to look at is our culture. As Nigerians, as Africans, quite often a woman's strength is measured by what she can endure in silence. But I have seen creative measures take place in other countries. There's a current program where people can call the police and pretend that they're calling to order food. And so when you ask for a particular pizza and they're asking you, you're actually giving the alarm that you're trapped with an abuser. The other thing that I would really, really like Nigeria to consider is actually adopting what we call the Isange model, where the gender-based violence reporting is actually made standardized through primary health centers. And to the extent that the woman does not have to report, or the victim, actually, I should say, because the victim is not always female, that the victim does not have to report. If somebody goes to a hospital and doctors are trained to recognize the signs of physical trauma and even mental trauma, these doctors can take forensic evidence and then we can kick in the system another way. The one thing that we do know is that it is only a woman who is really in fear of her life that will actually report her abuser to the authorities.
Thank you very much, madam. We've had a great time with you this morning discussing a number of issues on COVID-19.